Good morning and welcome to the Xavier Clinic. You're here for the 9 o'clock Cranial Nerve Examination. Is that correct? Marvellous. So, basically, the Cranial Nerve Examination is a rather simple and routine exercise. I'll be testing 12 of the nerves in your cranial area. I'm sure you knew that already, having come in for the examination yourself. I already have your full medical history. Can I just take your name, please, just to make sure that you are indeed the person who I am meant to be performing this on? Very well. Yeah, I know the spelling well, don't worry. I'd like to introduce myself to you. I am Dr. Xavier, and I will be assisting you through this examination whilst also assessing your general health and well-being through the speed and sophistication of your responses. I ask that you try your hardest to complete my requests promptly and successfully. Of course, if you are unable to complete one of the requests, it seems that there's probably a problem and I will give you another consultation. Marvellous. So, are you ready to begin? Excellent. So, the first nerve we are going to test is the olfactory nerve. Okay, I'm just going to make a couple of notes on here. Is that okay? It doesn't unsettle you at all? Fine. Marvellous. So the olfactory nerve is what you would expect it to be, right? From the derivative, it is to do with your sense of smell. Yes, marvellous. So what I'm going to do is I'm going to place a number of stimuli under your nostril while you cover the other nostril. I can do it if you like, but most patients prefer to cover it themselves. Covering yourself. Marvellous. And I am going to use a number of non-irritating and distinctive smells. And I would like you simply to tell me what they are. And this is checking for bilateral or indeed unilateral loss of your sense of smell in one of your nostrils, which can often coincide with rhinitis, smoking, or aging in general, deterioration of the body. And it is possible, however, that you may have a nerve lesion or a deviated septum, your septum being the little dividing line between your two nostrils. You can tell because my nose is rather large, as you may have noticed. It's an Xavier family issue. This isn't always included on the exam, but I feel that it's important to perform it. So, are you ready to begin? Marvellous. So what I'd like you to do is I'd like you to cover one of your nostrils, and I'm going to place the scent underneath. Of course, you will need to close your eyes so you can't see the scent approaching. Okay, marvellous. You might be able to smell it from here actually. Oh, you can, but that's a good sign, yes. I'll put it under your nostril anyway, just to make sure you can still smell it in the test conditions. Yes, correct. That is cinnamon. Favourite spice? The second, can you please cover your other nostril? Marvellous. I like the smell of this for myself. Yes, clove. Marvellous. So, you've done very well thus far, but I'm just going to do one more to make sure that you really are capable of smelling everything. So again, eyes closed, and I'm going to check for bilateral loss this time, so please just leave both nostrils open. toothpaste. Came accompanied with a tissue just to make sure that I could put it away successfully. So the next thing I'm going to do is I'm just going to quickly input all of this into your records. And no bilateral loss and no unilateral loss. So your olfactory nerve is A-OK. Which means you have avoided meningioma. You don't need to know what it is. It's just, I would tell you what it was if you had any problems. Okay, so now we're going to proceed to the second test, which is of your optic nerve. And this is effectively testing your visual acuity, alright? Do you wear eyeglasses? No? Okay, we can skip that then. No need for a Snellen chart test. In this test we are testing for optic neuritis. It's simply disease of the optic nerve. Very well. I'm going to test your visual fields now in both eyes, alright? I'd like you to cover one eye while I wiggle my finger in all 4 quadrants. Okay? And I'd like you to tell me when you can see my finger in the periphery of your vision. Do you understand what I mean by a periphery? Right. Good. So, I'd just like to inform you that my own visual fields are indeed normal. They are tested rather regularly, and that provides sort of a baseline for the whole thing. Alright. Marvellous. I'm just going to put that down. Okay, so I'm going to cover one of your eyes, and then I'm going to waggle my finger, alright? Excellent. And your other eye? I'm just going to write down that that one is okay. Good. Are you ready? Great. Well, marvellous. So your visual fields are great. In fact, you are very, very prompt in your response. Now we are going to move on to the fundoscopy stage, which is your pupillary light reflex. Now, some doctors will use a pen light, but I think they can actually be quite damaging to your retina. So, what I'm going to do is I'm going to ask you simply to close your eyes for 5 seconds, hold them tightly shut, okay? And then I'd like you to open them rapidly, and I will observe what happens to your pupils, okay? I will demonstrate. 5, 4, 3, 2, 1, open. And you can see there are changes to my pupils. You observed this, yes? You know the signs of it, right? Marvellous. So that's done. I've informed you of that. Okay. Well, I will count down for you. Okay. Close your eyes tightly shut like this. In 3, 2, 1. 5, 4, 3, 2, 1. Open. Marvellous. Brilliant. So your optic nerves are fine. I'm just going to put this form on the back. So no problems with your optic or olfactory nerves. This is probably about a quarter of the way through. You know, we've only done 2 nerves, but these are very quick tests that I can do for the further nerves. So now we're going to do test number 3, 4, and 6. Why 3, 4, and 6? I think it's best to ask a medical professor for that. I mean, I simply do it by the book. So first of all, I'm going to inspect your eyes for ptosis and nystagmus, alright? This will be your ocular motor nerve. Just move them around a bit for me now. Marvellous. Okay, no ptosis, no nystagmus. can I just... These your pupils are normal size. Correct shape. No asymmetry. So basically you adhere to the PERRLA abbreviation, which would mean pupils equal, round, and reactive to light. Okay? And accommodation, of course. Done. I'd like to now test your ocular movements by asking you to follow this target with your eyes only. No following it with the head. Alright? Brilliant. Marvellous. Okay, now I'm going to test you for visual fields. We've already done your visual field, but I'm going to just simply hold to the edge of your visual field and see what happens there, alright? See what happens to your eyes. Okay. Good. 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 I'm now going to move the target towards your nose. I'm going to demonstrate this on myself, and I'll show you what happens, and I want you to keep looking at it, alright? As you can see, my eyes go a bit crossed. Right. Brilliant. Do you understand what to do? Again, you know, my nose is rather sizable. Marvellous. Good. No problem with optokinetic nystagmus. That's fine. Okay. Ocular motor nerve, fine. Trochlear nerve, fine. Abducens nerve, fine. You're doing so well. So now we're moving on to test number 5, inexplicably on to test number 5, which is for your trigeminal nerve, alright? What I'm going to do is I'm going to touch your forehead to test the ophthalmic division. I'm going to touch your cheeks to test the maxillary division, and I'm going to touch your chin to test the mandibular division, alright? So I'm simply going to touch your forehead, touch your cheeks, and touch your chin. Does that suit you? Great. No uncomfortableness with that at all, right? You know that I'm a completely qualified practitioner, physician, nothing wrong. Okay, so I'm now going to touch your forehead. Good. I'm now going to touch your cheeks. Good. And your chin. Marvellous. All good. No problem with your auricular nerve. Great auricular nerve. I'm now going to check pain and temperature, right? There's no real pain. I'm literally just going to press my pen in a little, so a bit like... See what response is. There's no pain on my cheeks, is there? It did happen once. A new chin, okay? This is a little cold. That's why I use this pen with a metal tip. Right. No problems. Marvellous. No problem with your corneal reflex either. Brilliant. I'm going to test some other stuff later. I'd like to check your muscles of mastication, please, which are your temporalis and masseter. That's very sort of technical or medical, no reason to know about that. So, please may you clench your jaw, okay? And then I'm going to just simply palpate the temporalis and masseter. I'm going to touch them, okay? Clench your jaw like that. Brilliant. No problem at all. No problem with mastication. I'd like to check your pterygoids, please. All I'd like you to do is simply keep your mouth open against my resistance, okay? So I'm going to go. I'm going to try and close it, like... You see? You can never look attractive during a cranial nerve examination, unfortunately. So, just again, open your mouth, please. Marvellous. Pterygoids are fine. Yeah, that's fine. So, on to test number 7, your facial nerve, which is testing for Bell's palsy, Ramsay-Hunt syndrome. Okay. Horrible English there, I'm very sorry. So I'm just going to check first of all for any facial asymmetry. Now, this is not me assessing your looks, this is simply me assessing your medical condition, alright? Good. Now, we're going to do 6 motor tests, alright? The first is going to be you raising both eyebrows. I'm just going to remove my hair from my face. Raise both eyebrows like this. Marvellous. I'd like you to frown as if you despise me. Good. I'd like you to close both eyes tightly. Again, as if you despise me so much you don't even want to look in my face. Marvellous. And I'm just going to test the muscular strength by attempting to open them, okay? Great. I'd like you to show me your upper and lower teeth. This isn't an examination of your dental work, although we'll be able to refer you to a dentist if they are looking bad. So, yeah, I'd just like to see your upper and lower teeth, please. Like that. Marvellous. And your lower teeth. Ignore how awful mine are. It's really not good. I'd like you to smile, as if you don't despise me. Marvellous. I'd like you to puff out both cheeks, please. Again, impossible to look attractive during a cranial nerve examination. That's great. No sensory problems, no Bell's palsy, and no Ramsay-Hunt syndrome. I'd now like to test your vestibulocochlear nerve, okay? Which is something to do with your hearing. I'm checking for acoustic neuromy. You can guess what that is. Basically, problems with problems with hearing things. Yeah, you know what acoustic means, right? Play the acoustic guitar. Makes sense. Okay, now, first of all, I'm going to whisper some numbers in your ear, and I would like you to repeat those numbers, alright? Okay, ready? 4, 6, 9, 9. 4, 6, 9, 9. Marvellous. And in the other ear. 7, 8, 8, 0. It wasn't 8, 8, 1. It was 8, 8, 0. I'm just going to check that again. I'm going to put a little mark. Make sure my pen's actually open. Different numbers. 1, 9, 0, 4. Good. Oh, it's just you saying the wrong thing? It's a bit bizarre. That seems fine, actually, yes. Furthermore, I'm going to ask you to close your eyes and tell me on which side of your head, from which ear, left or right, you can hear the numbers, alright? 1, 4. Correct. Once more. 6, 6. Correct. Once more. 7, 2. Correct. It's bizarre normally at the start. Are you feeling okay? Do you want a glass of water or something? No? Okay. I'm now going to produce a rustling sound, okay, in order to perform the Rinner test and Weber tests to test your vestibular function. So I'm going to vigorously rub my fingers together in one ear to produce a rustling sound, and I'm then going to do it in the second, alright? Would that distress you at all? No? Marvellous. Do my hands as well. Okay, that's a normal response from your ear. And the other? Hands. Normal response. Marvellous. I'm now going to perform tests 9 and 10 on your glossopharyngeal and vagus nerves, alright? Yeah, vagus nerve, not all cocaine hookers. So first of all, do you have a gag response? i.e., are you able to go? Marvellous. can I please see your uvula? Now, it's really grim. It's the thing that flicks food back into your mouth. Have you ever seen Monster House? Yeah, you know what your uvula is then. Uvula. Uvula. It's a great word, isn't it? So just show me. Marvellous. Again, I promised you it's impossible to look attractive during your cranial nerve examination. I'd like you to articulate with your tongue depressor, all right? Marvellous. I'd like you to perform a palatal articulation. These are linguistic terms. A palatal articulation. Ka. Ka. Good. And finally, a guttural articulation. Go. Go. Marvellous. Meaning that you do not have lateral medullary syndrome. Marvellous. Trust me, that's good news. Good news. You've done so well so far. Nerve number 11. And remember, there were 12 nerves, so we are finally done. We're now going to test your accessory nerve, all right? I'd simply like you to shrug your shoulders, like this. Bit of a Gallic shrug, you know. Je ne sais pas. Je ne suis pas certain que cela est le cas. Oh, you speak French? Vous parlez français? Ah, c'est parfait. Just the Gallic shrug really, really well. There's no need to speak some French while doing it, by the way. You know, you can shrug your shoulders normally. That's completely fine. And I'd like you to turn your head from side to side, please. Do a model pose. Okay, like. Good. My good side. Oh. Told you it's my good side. Good. No problem with your accessory nerve. Finally, nerve number 12, your hypoglossal. I'd like you to stick your tongue out and move it to one side and then the other. I'll demonstrate. Again, it's impossible to look attractive during a cranial nerve examination. Go. Great. And can I just see your tongue, please? I'm just going to put my pen on it like this. Don't worry, I sterilise every time. Okay. Yeah, no atrophy, circulation, asymmetry, and movement for appearance. No. Well, you have passed your cranial nerve exam. I don't think that's quite the right word, but it's success. So, I'm happy. Marvellous. Okay. Thank you very much.